Welcome to the California Spine Institute, dedicated to helping people with spinal injuries or diseases return to a pain-free, active lifestyle. Here at the Spine Institute, our philosophy is to help our patients' own bodies begin the process of self-healing. By combining state-of-the-art technology, along with the most advanced, minimally invasive surgical techniques.
85% of Americans will have some type of back problems in their lifetimes. Many of these people believe their only option are to live in constant pain or to have drastic treatments such as open spinal surgery or spinal fusion. That isn't the case. I have dedicated my life to developing and practicing minimally invasive spinal surgery that attempts to quickly eliminate the pain and return flexibility to my patients. In most cases, these patients are discharged within an hour after surgery and can begin exercising the very next day.
To help demonstrate how the Spine Center can restore your back and spine to a more healthy state, please watch the following program that illustrates the complexity of spinal problems and how the Spine Center can help.
This is what the human body is capable of at its peak. Acrobats like Alexei Voitenko make this seemingly impossible look deceptively easy. At the heart of this amazing machine is the human skeleton. And the human skeleton works in a fundamentally different way from all other animals. We're the only creatures on Earth to walk fully upright on two legs. Our ancestors took this giant step 3 million years ago, and we've been reaping the benefits ever since, like freeing up our hands to make things instead of using them to walk on. But abandoning the tried and tested four-legged walk meant some pretty radical changes to our bodies. The end result was to stack all our body's weight vertically onto our spine. So now, we're a walking accident waiting to happen. And for those of us who have had one, it isn't funny. 2 years ago, Roberta Brubaker fell off her bike and jolted her spine.
That's the structure, that's the support beams of our bodies, is our backs. Everything branches off of it. And you never know how bad it can be until it goes wrong. It's a small little problem in my back, but because it's my back and not my hand or my foot or my head, it's affected everything in my life. I'd love to get a shovel and dig them up, but I have to plan every move. If I lean too far, then I pop my back up.
Roberta has slipped a disc, which means the cartilage in her spine has moved, pressing on the surrounding nerves. Dr. John Chiu comes across this kind of injury all too often.
Most of our job require either sitting or prolonged standing, which are bad for the spine. And spine means to move, not to be in a static position. Because of our lifestyle, 85% of population in the Western world has some low back problem during their lifetime.
Roberta has come to the California Spine Center in the hope that he can achieve what other doctors have so far failed to do, cure her back pain.
Do you have any pain right now?
Oh, do I have any pain right now? Oh yes.
Yeah,
oh, yes.
on a scale of 1 to 10.
9.5.
Okay.
Yes.
Dr. Chiu has pioneered a form of surgery that uses a laser to remove the offending piece of disc.
He is going to make a small incision in my back and go in through my spine, and with a small holmium laser, he's going to buzz off the disc bulge that is bulging out towards my spinal cord, and the rest of my disc will be able to relax back, and I'll be better.
The operation is performed under local anesthetic. Guided by X-ray, Dr. Chiu feels for the gap between Roberta's vertebrae.
Yeah.
With the way open, a tiny camera guides the critical stage,
Now I'm going to go in now.
removing the disc bulge millimeters at a time. Just an hour after she arrived, Roberta is able to walk out of the clinic, a woman reborn.
I feel great. It's truly overwhelming to be out of pain. No pain. I'm out of pain. I'm out of the world of pain. I want to walk. I want to
go to the beach.
Go to the beach. I want to dance. Oh my gosh.
Thank you very much.
Thank you so much,
Have a
Dr.
safe
Chiu.
travel.
Okay.
This is just one person's story. There are many more to be told. The patients who come to the Spine Center arrive here from all over the world. Some are famous, some are not. But all of them had one thing in common. They had a back injury that needed to be fixed, and they wanted to have it done without undergoing a traumatic and painful procedure. With our state-of-the-art computers and equipment, the doctors at the California Spine Institute can, within minutes, scan your body, process the data, and produce fully textured three-dimensional replicas of your body, including the skeleton and circulatory system, as well as the major internal organs. These 3D images provide a complete, accurate model of your body, allowing our doctors to quickly diagnose your condition, moving you toward the proper treatment and therapy, ultimately reducing or eliminating your back pain.
I believe that the human body should be self-sustaining and self-healing. Sometimes injuries occur that need outside help to heal. With minimally invasive spinal surgery, your body often can resume the process of self-healing with faster recovery and less pain and discomfort. Traumatic procedures such as open spinal surgery or spinal fusion can sometimes be worse than the disease or injury itself. With the techniques that I have pioneered at California Spine Institute, one can often quickly return to a normal, active life, free of back pain.